guys, Dr. Vaji here. I'm a core surgical trainee working in the UK, and for some reason, I thought it'd be a good idea to go through this painstakingly long document called the ISCP Core Surgical Training Curriculum. A few nights and a couple of coffees later, I've finally managed to figure out how are trainees assessed through their training, and what is the evidence that we're supposed to gather by the end of the 2 years to successfully pass core surgical training. If you're interested in finding that out, I'd recommend watching all the way till the end. You can 2x the video if you want, or skip ahead. Timestamps are going to be in the description. Full disclaimer though, some of this information may become outdated with time, so always go to the ISCP website for the latest information, and do consult your clinical and educational supervisors for the evidence that you should be gathering. Secondly, I haven't really gone through the ARCP process myself, but I thought it'd be cool to look up the things that are expected of us and make a video pre-ERCP, and then hopefully I'll make one after ARCP as well and link it up in the top right hand corner here. So, core surgical training. We do know that it's a 2-year structured training program. Some people may take less than 2 years to gather the evidence, and some people may need more than that. But generally, we will rotate through various surgical specialties and be expected to complete the common content module, core surgical specialty module, and the ST3 preparation module. If you don't know what those modules are, don't freak out, because the way that our training jobs are designed is to facilitate us completing those modules pretty naturally. So I'm pretty sure you must have gathered most of the information you need to check all of the boxes in here, but it is still good to know what exactly are we working towards. This is the assessment system that our trainers utilize to assess our progress through training. So I'll take you through each of these in step. You can see that there are some formative assessments and summative assessments, and some mandatory ones and optional ones. Now, for the mandatory ones, you're going to need to do some mandatory work-based assessments like CEXs and DOPS for critical skills you need to develop in core surgical training. I'll talk about what those are and how many you need in just a minute. Next, you're definitely going to have to pass your MRCS exam by the end of the 2 years. The next mandatory evidence includes the MCRs and trainee self-assessments. Here, your trainers are going to rate you for the competence level for general professional capabilities and capabilities in practice, and you'll rate yourself as well. And then your AES will sit down with you and they will discuss the results of these with yourself. Multi-source feedback are basically feedback forms you gather from other colleagues, and they're a good source of gathering information on how you collaborate with different people on the team, including your juniors and the allied healthcare professionals. You need one of these in a year, and then come your optional work-based assessments like the mini CEXs and CBDs or DOPS or assessment of audits or teaching that you're going to do to show evidence of progression. All of these combined will help inform your AES, who will generate a report, which will in turn feed back to the ARCP panel, who will determine whether you move on to the next phase of your training or not. Now, what does a typical placement look like? So this is what a typical placement is going to look like. So say you're starting off a 6-month general surgical rotation. You'll divide that rotation into 3 months each, and at the start of your rotation in the first month, you want to have your educational supervisor meeting and generate a learning agreement where you've set objectives for the rest of the placement. And then you'll go through the placement for the first 3 months, gathering evidences to support your progression, and come the midpoint, say after the 3rd month, you're going to generate a midpoint MCR and self-assessment. Now this is optional, but the ISCP highly recommend that we get this done because it helps identify any weak areas that we may have, which then we can target early in the second half of the placement. So after your midpoint MCR and self-assessment, the mandatory bit is going to be the midpoint AES meeting, where you'll sit down with your educational supervisor and discuss whether you're keeping on track and getting the right opportunities, and if there are any changes that you need to make. Then you'll go about the rest of your placement, gathering more evidences of progression, and finally, towards the end of the 5th month, you'll generate your end of placement MCR, and early 6th month, you're going to have your final AES meeting. You'll reflect on how you did in this placement and will set the tone for the upcoming placement. Now, if I were to list down the things that you need to gather during each placement, it would be a completed learning agreement, CEXs and DOPS for critical skills, a multi-source feedback, you just need one per year, an up-to-date logbook. Remember, you need 120 cases a year, so keep logging them as you go along, because doing it towards the end of the year might not be very practical. A final MCR and a final trainee self-assessment. Like I said, the optional ones included midpoint MCR and midpoint trainee self-assessment, and then you have your other work-based assessments. Now, I'm going to talk about the mandatory DOPs and KEXs you're going to need and the competence levels you need them at. First up, you're going to want to have 3 KEXs done in an outpatient setting and 3 KEXs done for the wards or A&E for an acutely unwell patient. And you need to have a competence level of 2, which means you can do with assistance for these KEXs. And for the DOPs, you're going to need 3 for surgeon preparation, which is basically gowning and gloving, 3 for local anesthetic, 3 for prepping and draping, 3 for incision, 3 for closure, and 3 for WHO checklist. And you only need them to be at a level 3, which is can do whole but may need assistance. And the only DOPS that needs a level 4 competence is the gowning and gloving, which, if you ask me, all of these are pretty realistic and pretty easy to achieve. Now, talking about the optional work-based assessments, obviously a large part of it will depend on which specialty you're rotating in. But say you're rotating in general surgery and you want to pursue general surgery in the future as well, I would try and make sure that I gather the necessary DOPS, KEXs, CBDs to evidence that I am getting more competent in managing index general surgery cases. So if you go onto the ST3 preparation module, they've listed out some index cases that we should be competent in managing by ST3 applications. And they've also listed some technical and procedural skills that we should have and the competence levels that we need to attain in order for us to complete this ST3 preparation module. So that's where I would be focusing my efforts for optional WBAs. Obviously, optional WBAs should also be used to evidence progression where in areas you feel like you're weak in. So if they've identified certain areas where you need work, then obviously utilize the optional WBAs over there as well. But say if you're satisfactory, keep building your portfolio for that ST3 application. Now, say you've progressed through your 2 years and coming towards the end, what are the things that as a minimum you need to evidence in order to complete core surgical training? In order to complete the common content module, you need to have passed your MRCS. If you're thinking of taking ENT in the future, then MRCS ENT. You need to have completed all the mandatory KEXs and DOPS. You need to have an in-date trauma certification. So most commonly ATLS. You need to have a completed AES report and 1 CS report from each placement, an up-to-date logbook that evidences about 120 cases a year, so 240 by the end of 2 years, an MSF from each whole-time equivalent training year, and an MCR from each placement. Really quickly, now if you're rotating through a specific specialty, you'll be expected to complete the core specialty module for that specific specialty. Again, what this essentially means is if you're rotating through, say, a specialty that you're not really planning on pursuing in the future, it doesn't mean that you shouldn't gather work-based assessments or logbook evidence, because you will need to evidence this towards the end of CST, and you need to have completed at least 1 core specialty module, and it'll be very rare that all of your rotations are going to be in a single specialty. But again, the jobs are structured so that you will probably go through all of the tick boxes that you need, but just be sure to gather some work-based assessments to highlight that you have completed the specific core specialty module. The ISCP website has information on what evidences you need to gather for specific core specialty modules. And then finally, when you're in your CT2 year, or some people might even begin in CT1, when you're completing the ST3 preparation module, you're going to want to gather work-based assessments and logbook evidence and CS reports covering the specified areas in the syllabus, like the one I showed you earlier. Additionally, your final MCR should show capabilities at the required supervision levels or better. So what these supervision levels include are basically, when it comes to managing an outpatient clinic, the take or the operating list, you need to be at a 2B, which is you're able and trusted to act under direct supervision. Most of the capability conducted under direct supervision. So nothing fancy like doing it on your own, really just be able to do it under direct supervision. You should be able to do the ward rounds at a level 2C and a multidisciplinary work at a level 2A. So all of these seem to be very achievable targets. And remember, your jobs are going to be geared to facilitate you to complete all of these modules. All you have to do is you basically just gather logbook information, ensuring that you're checking off all of the boxes. So if you need any sort of information, do visit the ISCP website and look at their curriculum. It contains a plethora of information about the type of evidence that you should gather, the way you're going to be assessed. And I think it makes more sense to know why we're doing something, when we're doing it, and it just sort of motivates me more to actively seek out these opportunities as opposed to just passively recording them without a clear plan in mind. So I hope this helped make sense of what core surgical training is going to be like. Let me know if it helped or it ended up confusing you more. However, if you're still early in your career and you still haven't gotten into core surgical training, here's a video on what are the latest requirements from applicants for core surgical training.